Veterans hospitals are struggling to replace hundreds of doctors and nurses who have left the healthcare system this year as the administration pursues its pledge to simultaneously slash Department of Veterans Affairs staff and improve care. Many job applicants are turning down offers, worried that the positions are not stable and uneasy with the overall direction of the agency. According to internal documents, records show nearly 4 in 10 of the roughly 2,000 doctors offered jobs early this year turned them down. That is quadruple the rate of doctors rejecting offers during the same time period last year. The VA previously said it intended to cut its workforce significantly, sparking alarm about impacts on patient care. Officials later revised plans, stating a smaller reduction by the fiscal year end would be achieved through voluntary departures, avoiding mass layoffs. A review of staffing records and interviews, however, reveals a different picture of how staffing is affecting veterans' care. After years of adding staff, the VA this year is down more than 600 doctors and about 1,900 nurses. The number of doctors on staff has declined each month this year. The agency also lost twice as many nurses as it hired recently. A VA spokesperson accused critics of bias but acknowledged the agency is working to address the rejection rate by speeding hiring and using strategies like private providers and telehealth. The spokesperson attributed challenges partly to a nationwide healthcare worker shortage and claimed recent changes haven't compromised care, citing improving wait times after a prior increase. While VA statistics show only slight reductions for existing patient wait times since the administration change, times for new patients seeking primary and specialty care have slightly increased. As of early July, the average wait nationally for new outpatient surgery appointments was 41 days, exceeding the VA's goal. In some locations, waits are longer, such as a 2-month wait for primary care at one center in Maine, triple the VA goal. At that location, a veteran's spouse described difficulties in getting timely care and said her disabled husband had no assigned primary care doctor after his physician left. The VA stated it's recruiting primary care doctors in Maine. Nationwide, the doctor vacancy rate rose recently. Critics argue the VA is heading dangerously, with dedicated professionals fleeing due to toxic conditions and funding cuts. One senator said the findings reinforce concerns about damaging impacts. An internal presentation from Texas cited job offer rejections due to uncertainty of reorganization and low morale deterring employee recommendations. A veteran there described a downgrade in care, including lost records and longer appointment waits, echoed by others. Administrators expressed concern about institutional knowledge leaving due to departing supervisors. Delays are also caused by shortages in support staff. In Ohio, vacant purchasing agent positions delayed acquiring hundreds of prosthetics, though officials said processing time improved lately. Some facilities struggle to hire mental health staff, with job offers declined due to changes requiring on-site work, leading to projected longer appointment delays. Concurrently, the administration scaled back key recruitment tools like retention and signing bonuses. Far fewer bonuses were awarded compared to the previous year, with the VA telling lawmakers jobs were filled without incentives. Some lawmakers allege bonuses are withheld intentionally as part of a plan to privatize services, claiming the goal is to push employees out and decimate the VA workforce.